Another feature of the new Fundamentals 11th edition is the broadened application of clinical case studies. A single case study in each chapter evolves through each step of the nursing process to illuminate all concepts related to clinical judgment. Using practical, real-life scenarios, the case study shows a student how steps of the nursing process are performed and critical thinking components applied. Here is a summarized case study from the safety chapter. This case study is available in SurePath. SurePath is Elsevier's personalized learning and teaching technology built specifically for healthcare education. The case study also provides next-generation NCLEX content. Unfolding case studies include NGN question types outlined by the NCSBN. Mrs. Cohen is 78 years old and lives at home. The patient is recovering from a stroke 10 days ago, affecting her left arm and leg. She also has some slurring of speech. Mrs. Cohen lives alone but receives regular help from her daughter and son, who both live within 5 miles of the patient. She is scheduled for home physical therapy starting this week. Kylie is Mrs. Cohen's assigned home health nurse who will be making her first visit today. Her assessment will include an examination of the patient's neurological and musculoskeletal systems. She also considers the patient's age, knowing that being 78 places the patient at risk for injury due to normal physical and cognitive changes. Good morning, Mrs. Cohen. Let me start by asking you a few questions. Tell me what you most want us to help you with. The doctor put me on several new medicines. If my kids can't be here, I need to know how to take them right. I want to get my strength back in my arm and leg so I can walk. Helping with your medicines and getting you to walk again. That is a good plan. Now tell me, have you fallen at home any time in the last 12 months before your stroke? Kylie analyzes her assessment findings so far. She knows that she will continue her assessment during her next home visit. Currently, she recognizes a pattern with Mrs. Cohen's age, history of previous fall, reduced strength and impaired balance, and environmental hazards as risk for the diagnosis of risk for fall. The patient's weakness of left leg, reduced ability to move her walker forward, weakened hand grip, and dragging her foot are assessment findings for impaired mobility. Kylie sets the outcome of patient will not fall in 1 month for the diagnosis risk for fall. Kylie hopes to extend the time parameter for the outcome, but she knows Mrs. Cohen has a high risk for falls as she recovers from the CVA. Fall prevention will be a priority in the initial weeks. The outcome for impaired mobility. Patient will ambulate with walker correctly in 2 weeks is ambitious for Mrs. Cohen. The patient has obvious weakness on her left side, but Kylie plans to collaborate with the physical therapist, the patient, and Mrs. Cohen's children to plan rehab strategies for strengthening Mrs. Cohen's walking ability. Kylie intends to make fall prevention the patient's first priority, because during these next few weeks with the patient's instability following a stroke, safe mobility is key. You said your plan was to be able to become stronger and walk again. To do that, we need to work together to reduce your risk for falling. Having fallen before, your age, and the effects of your stroke place you at risk. Your medicine for blood pressure can also cause you to become dizzy when you first stand. I thought my medicine was meant to keep me from having another stroke. It is, but it also has what we call a side effect. It may sometimes cause your blood pressure to drop when you stand up after sitting or lying down, making you dizzy. I know both of the medicines help lower my blood pressure. One of them makes me go to the bathroom more often. I take each medicine once a day Taking these 2 medicines along with her vitamin supplements should make for an easy routine. Kylie has Mrs. Cohen and her daughter review the best times to take the medicine in the morning and tells them she will check their success in managing the medicines at her next visit. Kylie finishes her visit with an explanation of Mrs. Cohen's fall risks and how she and her children can help to make the home safer. Mrs. Cohen agrees to the changes. To ensure the patient understands instructions, Kylie will ask Mrs. Cohen, "Tell me one final time, Mrs. Cohen, why are you at risk for falling?" The case study concludes with demonstrating how a nurse evaluates the patient's response to the interventions. In this case, the nurse has the patient explain her medicines and planned regime. She also asks the patient to describe her fall risks. This case study is available in SurePath, along with other next-generation NCLEX content that build knowledge and develop clinical judgment. For more on SurePath, visit evolve.elsevier.com/education/SurePath.